we should begin, if that's okay. Hi, Mark.
Hi, sorry, I was having technical difficulties, so you got me on my phone now.
All right, good. So I have an opening statement to read, and I will open the Board of Health meeting. In accordance with Governor Baker's executive order permitting virtual meetings during the COVID pandemic, the Board of Health is conducting this meeting today, August 18th, 2020, on the Zoom platform, and in accordance with the town's policy directive and guidelines issued on April 1, 2020, as amended. I ask that all Board of Health committee members, town staff, and presenters activate their video and mute their microphone unless they have something to say or are participating in committee dialogue. This meeting is being recorded and will be available for later viewing on the town's website. All committee votes will be taken via roll call, and we will start with an attendance roll call. When I announce your name, please reply. And for members of the public, please unmute yourself only when I've opened the meeting to public comment. So roll call, Mark Haddad.
Present.
Alma Healy.
Yes, present.
Jill Block.
Present.
Ray Considine.
Present.
All right, we are all accounted for. And so I will open the meeting of the Board of Health this evening. The first item for discussion is a public hearing on the subdivision on Main Street and Highland Street. Susan, do you want to give us a little bit of background on this?
I will, and I see that Rich Harrington and Jeff Ruda are here, so maybe I'll give a quick overview and then they can say what they would want, they can make their presentation. So this subdivision was formerly presented to the board as a preliminary subdivision plan, and it was a planned residential development which was denied by the planning board. So now they are coming back with a more conventional subdivision. The parcel is just under 8 acres. They're proposing to create 16 lots and then a couple of A&R lots. I hope you all know what the property is. It's at the corner of Highland and Main Street. The terrain is a hill, and they propose to remove quite a bit of soil and significantly regrade the property. Extensive test holes have been completed on the property for both septic and drainage. I counted 55 test holes in total that have been done over the 8 acres over 3 years. And the soils are consistently sand. So I'm pretty confident that compliant septic systems can be designed for the property. And with that, I will turn it over to the applicants.
Good evening, Rich Harrington from Williams Garages, engineer. Back in March 17th of this year, we met with the board, and they had 5 conditions that we're in agreement for that would carry through the preliminary plan approval. And basically what Susan said is it's a straightforward subdivision, and we're willing, the previous conditions of 5, we're willing to have those also carry through to the definitive plan also.
You want to remind us, Rich, what those 5 were, since I don't have the preliminary. So I think you approved 2 preliminary subdivisions back in March. One was the conventional subdivision and one was the PRD subdivision. Is that correct, Rich?
The conventional was approved. A preliminary conventional plan was approved.
Yep. And you want to remind us what those 5 conditions were, since I am not at my office?
Sure. Number 1 was that each septic system shall be designed and permitted in accordance with Title V and the local board health regulations. Second was town water shall be available. We are extending the water main into the site. Number 3 was any wells for domestic water irrigation purposes shall again comply with the local board health regulations, which we're fine with that also if someone does choose to put in an irrigation well. Number 4 is no underground fuel storage system shall be installed without a variance granted by the Board of Health in accordance with the underground storage tank bylaw. That shouldn't apply to this. I believe that goes back to oil tanks, which obviously don't happen anymore, but it's just something to carry through. And number 5 was tree stumps and wood waste generated by land clearing shall not be buried on site. And so those are the 5 things that were mentioned before. And there's no change to the plan from when the board previously saw this about 5 months ago. And we'll be heading to the planning board next month.
So I noticed in the plan that it's in the wetlands conservatory district. Is the septic system going to be impacting the wetlands?
No, they're not. They're all outside. They're all in the upland area.
Okay.
Each of the lots will have individual septic systems. It won't be a shared system. So all of them will have to be designed with proper setbacks to the wetlands.
And where are the wetlands in relation to the map? It's not coming out very well. Is it on the north
They're on
side?
the northeast side, behind where there's a green space in the top right, along the railroad track.
Okay. Okay. It's pretty packed in there. It's not, well, board members, do you have any thoughts on this proposal? Or this application, sorry?
I had just a question on what is lot A1 and D1? Because they're not included in this. Is that correct?
Correct. Those are houses that have frontage on Main Street and Highland Street, so they don't require subdivision approval.
Okay.
They're approval not required lots.
But they're
But
part
they-
of subdivision.
They are, it's, currently they provide frontage to the 2 existing houses that are
Mhm.
oversized lots. And then once we create the road, the excess land will be placed into the subdivision, and then smaller 10,000 square foot lots will create. So lot A becomes lot A1, existing lot D becomes lot D1.
And they will be developed then.
Yes, they will.
So there'll be 18 homes on the property?
No, there's more than 18.
How many?
20, 21 total, 22 maybe.
Are those the ones that are facing Main Street that are hard to distinguish here in the plan? That's where they're located?
Yes, there's frontage lots along Highland Street and Main Street.
Oh, okay.
Lots A through F.
Alma, you're muted.
I was saying, how about the very 2 large houses that exist presently on that land? Are they
Those-
going to come down?
Yes, those will be raised.
Okay. Mark, any thoughts?
No, I don't have any specific questions. I guess I'd want to know what Susan's recommendation is.
Yeah, Susan?
I recommend approval. Your approval of a subdivision is just really saying that you don't have any reason to believe the subdivision of the land would cause any impacts to public health. That's really all you're required to sort of review it under.
Okay, all right. Does someone want to make a motion to approve?
Sure, I move to approve the subdivision plan with the same, Susan, I assume the same 5 criteria we approved previously.
Mhm. Do I have a second?
Second.
Okay. All right, we will take a vote by roll call. Ray Considine,
Yes, I approve.
Jill Block,
Yes.
Mark Haddad,
Approve.
Alma Healy.
Yes.
All right, and I will approve as well. Thank you.
very much.
Thank you.
All right, let's move on to agenda item 3. So this will be a discussion of COVID. Susan, do you want to start by updating us on sort of the enforcement efforts or what's going on in the town?
So I would say we've spent a lot of time over the last month or so responding to complaints, mostly businesses where employees are not wearing masks, a few others. It's kept us busy. I mean, in general, I would say our businesses are quite compliant. I see a lot of businesses trying really hard to be compliant. But, of course, there's always a few businesses that don't seem to take it as seriously as they should. So Gabrielle has spent quite a bit of time doing inspections and working with businesses. We've called the Department of Labor Standards on a couple of them where we just couldn't get them into compliance, and DLS has sent their inspectors out. So it's consuming quite a bit of staff time.
That's unfortunate.
Yes, it is.
Oh.
And I do have some concerns. Everyone would like life to get back to normal. We're all tired of this. The town rightfully is concerned about our small businesses and the impact on our small businesses. So the Chamber of Commerce and Tourism is trying to think about ways to promote Concord, which I can understand, but I have a level of concern that events are being planned without, necessarily putting public health first. So that's going to continue to be an issue I may have to raise with the town manager when these events occur, and I may need some support from you going forward.
Sure. Yeah. Is there anything specific that you're aware of right now, or you're just hearing about things?
I think the restaurants in particular want to bring people back to dining.
Yeah.
And the outdoor dining has been going quite well. A number of restaurants have applied for permission to do outside seating, and I think that's gone quite well.
Yeah.
Now indoor seating is allowed, and not all the restaurants are doing it, but some are at reduced density. And I think they would like to do more to promote people coming back for indoor dining. And I think most people just don't want to do that, which is why I think they're not having great success with that.
Yeah. Yeah. It's still a risk.
Right. But I can see as we move into the fall and outdoor dining is not as appealing, there's going to be more of a push to get people back indoors, and I'm still not happy about, I just don't, I think we have to be cautious about that.
Yeah. Yeah. I agree. We may be headed towards another period of a, sort of lockdown, quarantine, if things get really bad in the late fall. So,
Yep.
Okay. Well, I'm sorry that the town is spending a lot of time on that. It's, wish we could all do better. Okay.
Well, I really, most people are being compliant, Deb. I don't want to paint this too negatively. I would say the vast majority of businesses are compliant.
Yeah, I mean, when I've gone around town, I feel like I see people wearing their masks and businesses, doing a good job. I'm out and about seeing that. So, but I think, there's always, there's always people that won't want to comply, and it is hard, especially if you're working all day long to be in a mask. I understand that. So.
Yep, I understand it too.
Yep. So.
And then we have Cynthia Rainey here. This isn't really specifically listed on the agenda, but
Okay.
Cynthia Rainey from School Committee is here to talk to us about the plan for reopening the schools.
Oh, great.
So we just voted tonight to formally approve the plans. I'll just go through them briefly in this. I can make a mistake or two. The elementary schools are going to open. We called in person, but it's only half day. They will then, oops, sorry about that. They will then be, oh, geez. They will then be dismissed and then do after learning in the afternoon
Okay.
at home. As Concord Rec will be running at each school an after-school program that will go from approximately 12:30 to 3:30 with an option to do the rest of the day.
Is that for sort of working parents and things like that?
Yep.
Okay.
I have no idea what the level of subscription is, though. It's going to be based at each site.
Mm-hmm.
So we're going to we can't exactly maintain the classroom cohorts, but we'll be doing our best to keep grades together as best we can.
Mm-hmm.
So it's not ideal, but working parents need something.
Agreed.
So at the middle schools, because we do have 2 sites, it will be hybrid by alphabet. So I believe it's a Monday, Thursday, Tuesday, Friday. We're not exactly sure what's happening with Wednesdays. I think the original plan was to have it be a flipping half-day situation with cleaning in the afternoon on Wednesday. But obviously the schools are going to be thoroughly cleaned every day, not just in the afternoon. Then the high school is just very similar to our middle schools with the same hybrid plan. We heard a very detailed and I thought very encouraging presentation from an HVAC consultant who seemed quite skilled. And the most interesting thing one of the most interesting things to me is that he is recommending, and we are implementing, zero pressure nursing rooms and waiting areas. So that was news to me tonight anyway. I had never heard that. Outside of his general recommendations is that he feels that most of the schools are pretty good. He is recommending, what are those names of those machines? The
HEPA filters.
yes, in our older schools particularly, and he said run them 1 hour before school all day and then 2 hours after school. So he felt like the addition of those with our current situation, leaving windows open at our older schools. The Willard School, he said, is such a sophisticated system that you don't need to open the windows, you just need to let it run. I'm just trying to think. In the Ripley building, he again was recommending the HEPA filters. I'm trying to think of what other specific health issues. I guess if you have questions, there's so much more information, as I'm sure you're aware.
I have a question, Cynthia. What's the plan if somebody gets sick for the schools?
So Dr. Hunter did present that tonight. I believe Lori said she's going to be very, very conservative. Outside of the community numbers we know, but if there's a case in the school, I think she said, and Susie, you correct me if I'm wrong, she said she would close the school maybe for a short period of time, but she would close the school. Is that what you heard tonight?
Yeah, I think it's going to be circumstance dependent. So Tricia and I have been working with Lori Hunter and Lisa Koski and Meg Jensen, who are the head nurses. We've met with them all through July to sort of talk about how this will work. We're ready to do the contact tracing. So all of the elementary school classrooms, if a child in an elementary school classroom gets sick, that whole classroom gets quarantined. And then in the middle and high schools, when the kids are circulating around from class to class, they're going to have assigned seating charts. The desks will be 6 feet apart, but out of an abundance of caution, if a child is sick, we will consider close contacts to be everybody that's sort of in that 6 foot radius, and those people will be quarantined. So it could potentially be a lot of people quarantined. Likely the building might close till we sort of assess if any of the close contacts are going to become ill, or we'll get them tested as quickly as we can after exposure, and we'll just sort of work through the contact tracing. So we actually have a pretty good plan for all of that.
We also had an extensive discussion about testing, which a couple of people on your board have been attending these meetings. I think the committee and the superintendent are leaning away from doing a lot of testing. I think everybody is interested in getting more information on the saliva tests. They seem much more affordable potentially and scalable to do ongoing testing, but I don't think, at least we don't know enough about that yet. But those are ongoing conversations. You know, I think local communities are frustrated that there's not a statewide or federal emphasis on testing. So each superintendent is having to sort of go off and try to find a way through the testing issue. And it's not, unfortunately, where we want our superintendent spending all of her time amongst everything else she has to deal with. But it is an important thing, and I think it would make many members of the community and our staff feel safer if there was some level of testing, but we're not really sure how to achieve that right now.
Yeah. Just to, you know, give the other board members a little bit of background. I think Susan and I and Lori Hunter were on a call with Mike Mina and Dr. Mike Mina, an epidemiologist, earlier in the summer, and then also on a call with a representative of CIC, which has a link to the Broad Institute, and the Broad Institute is really the, you know, the MIT affiliated lab that's doing the majority of our testing. In fact, about more than half of the testing at Emerson Hospital is actually sent to the Broad, and the results come back within 24 hours, and they're very reliable. But, you know, so what Mike Mina had really, as an epidemiologist, what he had really, you know, figured out is that to really track and prevent any kind of outbreak of COVID, you really need to be testing, you know, every student every week, or staff and students every week. And so, you know, at $45 to $50 a test, at, you know, 3,600 students, 600 staff, that's about $200,000 a week. And then you would just have to test week after week after week after week. So, you know, we could blow through, you know, I don't know how many school budgets in a period of a month. So that was really just, you know, wow, you can see what the gold standard is, but the gold standard is not affordable. I mean, I don't know what communities are able to do that kind of thing. And so we, you know, have talked about, you know, what would make the teachers, the faculty and staff, you know, most feel good. Would it help them to know that every student is coming to school that's had, you know, a COVID test before they show up on day one? Would that help them? Would it help the teachers to know that, you know, if, you know, we could get them tested quickly if there was a problem or if they got sick? So we have been kind of talking about things like that, but it's, you know, it's, and working with, you know, obviously people at Emerson Hospital to see how we can help as well. But obviously, like you said, all school systems, all school districts are dealing with this too. And it's really, really unfortunate that there isn't more help from the state or the federal government. I mean, it's just really, it's really sad. So anyway.
But I will say the good thing is that, you know, Emerson stepped forward and offered to help. And if we have kids who are symptomatic, we can get them tested and get results through Emerson in 24 to 48 hours rather than the 7-day turnaround at some of the other labs. And that is going to be immensely helpful.
Yeah.
For who really is sick and for doing rapid contact tracing. So that's huge.
That's huge. Yeah. Yeah.
So the school committee, and I'm sure the superintendent, really appreciate the support that has been provided by Susan and Emerson Hospital and the Board of Health. So it's going to be an interesting fall.
Yeah.
Yeah.
So any other questions about the health aspects of the reopening plan? Or
Cynthia, just a quick question on the elementary school. The after-school program, is that free to residents or is there a cost associated with it?
no, there is a cost, and I heard them in there. So the 12:30 to 3:30 is $600, and you have to sign up for the whole week. You can't sign up for.
It's 600 a week.
Correct. So, and then you can sign up for, I think it's $100 a day for the 3-hour extension. So it's not, it's a significant cost,
Yeah.
but that there is assistance for sure. And they feel like they built that into their costs. So families who need financial assistance can get it.
Good.
Thank you.
Cynthia, can I just clarify something? For the elementary school, you said that they're going to be learning in person for half day and then dismissed? Okay. And then in the afternoon, they learn from home or they go to the rec program?
So if they go to the rec program, they'll be distance learning. They'll have people there assisting them. So they'll have the same curriculum. They'll just be doing it at the school. So
Thank
there's
you.
no difference in their experience.
Okay. And then on the middles and the high school, the Monday, Thursday, Tuesday, Friday is hybrid by alphabet.
Correct.
They'll decide, okay, thank you.
Yep.
Okay. Well, I hope it goes well. I know everyone wants to go back to school.
Everybody's working really hard, and you
Yeah.
need a tour of the buildings, and it's amazing what they're doing to set up the rooms with the appropriate social distancing and, the bathrooms, and trying to make sure that everything is, especially for the elementary schools, it's quite a challenge. We're lucky that K1, I believe the bathrooms are in the classrooms. So it makes it a little easier to keep things going.
Yeah.
Yeah. So there's so many little things you take for granted.
Yep.
Yes. So.
Yeah. Well, thank you for your hard work.
Sure.
Yeah.
So I think we will probably come back with updates because I want to be sure we have a good dialogue going back and forth. So.
Yeah, absolutely. Please do. All right. Great. Thank you.
Thank you.
So,
All right.
so I sent you all the PowerPoint about the health indicators, the public health indicators that we're using as the basis for opening the schools. So I just want to sort of put in there that Massachusetts looks really good and Concord looks very good at this point. And, there's no reason to wait for it to get better because it looks really good. I mean,
Yeah.
if we don't start school now in person, it's not going to get better.
Exactly.
We just have to keep it where it is.
Yeah. Okay. Should we talk about town meeting?
Sure. So you've probably all heard that town meeting will be held outside, which I think is great. When we first talked about it, we thought we'd be well into phase 3 and perhaps into phase 4 before town meeting happened. And I had thought maybe we could have it inside in the gym, but we aren't going into phase 4 and even phase 3 has been paused. So it's going to be held outside and with social distancing and masks. And I think I've sent you the protocols for it. If not, I'll resend them. It's pretty well thought out protocol.
Yeah, I agree. I think it's well thought out. And I also think, it sounds like other communities have done this as well. I'm glad that we're doing it in September. Having sat through the high school graduation in like 95-degree heat, I can tell you I'm glad it will be September because that was very hot on the football fields, but and certainly not as long as a town meeting. So hopefully we'll have a nice, cool, lovely day.
So. I'm glad the high school got to have a graduation though.
Yeah. It was very important to, my daughter, obviously, and I think just kind of gave her a little bit of closure for finishing high school and looking forward to more online learning. All right. Anything else on schools or town meeting or anything?
No, I think that kind of covers it.
Yeah. All right. We'll see how it goes. A lot of people are putting a lot of work into that. So,
So I will just say that Tricia and I have also been working with all 4 of the private schools too, to make sure we've got the contact tracing protocols in place for them, and
Good.
working with their dining services to make sure, that that's all going to be done safely. And, every decision causes a cascade of other decisions.
Yeah. Yeah,
So
it does.
we've been busy.
You have like
do
no time else.
Is Concord Academy all remote?
So they're all going to be remote. They're going to be remote learning with no boarding students, but then they're allowing students back on campus from 2 to 6 p.m. to do things like sports and activities, so that the kids have some connection to the campus.
So the kids who are local but not boarding will be.
Right. So kids who were boarders, whose families can arrange local housing, those kids will be day students if they want to be close by or just remote from wherever they are.
It is going to be interesting to see how many students we have in Concord Center once they go back to school. So I was just wondering about them mixing with the Concord Academy students, but I don't think there's going to be that many.
Yeah.
No, I think the kids will come to campus and just do whatever activity they're going to do and then go home.
All right, thank you.
And I think Middlesex, at least initially, is going to keep their students on campus.
Yep.
Yeah, it's probably wise. Okay. I will move on to agenda item 4, board calendar and minutes. I think Karen sent the latest edition of the minutes with the final comments edited. Anyone have any last minute additions or corrections or thoughts?
Those were Mark's.
Marks?
I already got his. They were eked in. There were only a few.
If I know that Mark's read it, I kind
Yeah.
of just figure he's covered all of us.
I'm
so.
getting pretty good. It's really pretty much only punctuation and a few ifs, ands, or buts every once in a while
Oh,
now.
yes, an eye for detail. So good. Can we have a motion to approve the minutes?
So moved.
Second?
Second.
Okay. All right. And we will vote by roll call for the minutes. Is that correct, Karen?
Yes.
Okay. Ray?
Approved.
Jill?
Approved.
Mark?
I approve.
Alma?
I have to unmute. Yes, approve.
Okay, and I approve the minutes as well. Thank you. Karen, any comments on the dates of the next meetings?
The only thing to keep in mind is that if it does rain for a town meeting, then the rain date is Monday, September 14th. So I don't
Okay.
know who'll be going to the board meeting. But just keep that in mind. I don't know if they'd go to a second night, Susan. Did you know? Do you know that?
I don't know.
Yeah.
I don't know.
I think
So I'll
they're
just,
not. I mean, that
okay,
they're reducing the schedule so that they wouldn't have to.
Yeah.
okay. So
Yeah.
that's the day of the meeting.
If I can help here,
Yeah. Oh, hi, Jane.
Hi. I'm just trying to stay to protocol and be dark for tonight. My understanding is that one of the reasons we've had the extensive public hearings this week and are doing the public hearings ahead of time is there won't be any discussion at the town meeting. So it'll be presentation and votes.
Okay.
So that it can be done in one day.
Okay.
Great.
All right. All right. So then we'll
Thank you.
not likely to worry about a conflict on September 15th then.
I hope not.
Okay. All right. Well, we'll wish the moderator luck at moving the town meeting along then. That'll be quite a challenge.
Okay,
All right.
great. Thank you.
Good. Okay. Where's my agenda? Board member report. So I can just say that to start with, that Emerson I think as of last week, only had sort of one person under investigation for COVID in the whole hospital. We've treated and discharged a total of 130 patients. There have been 55 total employees that have tested positive and have returned to work. As Susan said, I think Concord has less than 5 cases, so we're doing quite well here. I don't know if you guys are aware that the FDA has recalled or issued an alert about a number of hand sanitizers containing methanol. We actually did have one case at Emerson of someone drinking the methanol, the hand sanitizer, and so overdosed on that. It was a pretty tragic case. So I hope that word is getting out there, because that's, I think if you were like me and trying to buy any kind of Purell possible, I think there's probably a lot more of that in our community and closets than we realize. And then I guess the only other, thing I would say is just, I've been involved in discussions of testing, the school and school kids and teachers and things like that, and really trying to link, the hospital to the community and get testing for people if we need it done. So, so hopefully be a liaison for that. But that's all I have to say at the moment, I think. Jill, did you have something you wanted to talk about?
Yeah, I just wanted to share what's been going on at Open Table and some efforts to really help out in Concord. So initially in the epidemic and the pandemic, we were definitely seeing, tremendous numbers of increased people coming for food at Open Table. And the numbers have subsided, and that's overall, that's for every program throughout the state. And it's in part because a lot of existing programs either changed their restrictions, so things that were limited to one community, or have expanded access, and a lot of other pop-up programs started. So for instance, at CCHS, there is a pop-up program through the Food and Nutrition Services. Yeah. We also know, like I was looking at Department of Labor statistics, and the unemployment rate between, in the past year in Concord has gone up by over 9%. Same thing in Carlisle. And what we were hearing is, people are there's just all these little things going on. There's a lot of little initiatives. So what we've done at Open Table, we convened very successfully in the town of Maynard all of these different participants that are providing food in different ways. So the small church programs, the local food pantry, the Council on Aging, and others. And we put together a real collaborative approach to distribution to reduce redundancy, efficiency, and make sure no holes were missed. We have been really working hard to do the same thing in Concord. We have a great relationship established with I think his name is Bryce McNaught. He's the head of food services at the schools. He's been great, because they did a small program where we're now distributing with them food to 70 households a week through the high school. We have a delivery program that had been established with the Council on Aging prior to the pandemic, that we were getting food out. But we believe, based on the statistics and based on data from the Greater Boston Food Bank, that there is still unmet food need in this community. Okay. We don't know exactly who it is, but we can make assumptions about that. There's probably people who are still unable to get out, that are afraid of getting out, that the issues of embarrassment and pride about, change in circumstances and need is probably driving more people to need. We have tried to convene this conversation in Concord and Carlisle. We had a great call, and I had reached out to Susan, who unfortunately couldn't join us because she had a DPH conflict at the same time. We did get a number of responses from town participants, and in the end, there was no representation except for the school system on the call from Concord. There was great participation from Carlisle, Board of Health, Council on Aging, schools. Without our school person from Food and Nutrition, we did not have any representation from the Council on Aging, from town management, and others who were all invited. And it seemed like there's some resistance to reaching out and trying to address this need. it's a hard need to define, but like as I said, we believe for all the different reasons that there's more need that's being there, and a coordinated effort just to get the information out to all of our different constituents would be just a good thing for everybody. And I just want to, raise this as a public health issue that we've definitely been a little frustrated at a lack of responsiveness from the different programs, with the exception of the schools, again, to this issue in all of the various forms of outreach that we have tried. So,
Jill, can I just interrupt and request that going forward, if you copy me on things, I can certainly highlight it at the select board level.
I would appreciate that. Happy to do that, Jane.
Yeah.
It's just been disappointing. And, that's really what I want to register here. It's just really disappointing that we haven't gotten a level of response that would be a common courtesy even.
Yeah, I agree. I think, there's probably, an assumption that there really isn't a problem of, food shortage in our, for our community members. I think that it's something that you don't see, that people are in their homes. And so it's sort of an invisible problem. So I think that we should try to bring this to light and sort of, work to reduce the stigma. And I think having town leadership talk about this and get more involved will be helpful. So, whatever we could be doing in the Board of Health, I think we should be helping. Yeah.
Yeah. Thank you. I mean, it's really it is the awareness raising and the reduction of stigma. We know that, like I said, there were 70 households going to the high school. We also know that Gaining Ground has a very, small program as well. And there might be we know that because it's off-site at Gaining Ground, people feel perhaps a little bit more protected. It feels a little bit more comfortable than going to, let's say, a drive-through service at a housing authority. But if you're hungry, and we give out really good food. So it's just disappointing.
Yeah, it is disappointing.
Yeah. So anyway, that's just what I wanted to share. Just, real frustration.
Thank you. No, it's important.
Thank you, Jane, for being willing to, help us with our efforts to get the word out.
Absolutely, and I wish I'd known about this first round.
I'll keep you posted. So
Great. Any other reports from board members? Okay. Susan, do you want to talk about tobacco control efforts?
Yes, so we are very fortunate to have Erin Murphy with us. You may remember that we got state funding to create the 4-town tobacco control district with Wilmington, Lexington, Bedford, and Concord. And we have recently hired Erin, who's with us, and she can introduce herself. And I thought it seems an eternity ago that we reached out to the tobacco retailers to talk to them about the new regulations. We did do a big mailing about what the new regulations required.
Yeah.
That was in February, and I'm sure none of them remember anything we sent to them at this point.
Right.
It's like a different world ago. So my thought is that Erin is going to start that whole educational process again before she starts doing compliance checks for signage and products being sold. And she has been working with Maureen Busby at Mystic Valley Tobacco Control, who's been training her. And with that, I'm going to let you say something, Erin. Introduce yourself.
Hi, everyone. It's nice to meet all of you via Zoom.
Thank you. We're very excited to have you.
Thanks. So my name is Erin. I recently graduated from Syracuse University in May with a bachelor's degree in public health. I first became interested in public health and tobacco prevention when I served as a youth action team leader for Wakefield Substance Abuse Coalition. So we worked on a variety of substance issues, including nicotine addiction. So I'm excited to be involved in enforcing the state's new tobacco law, as well as your local regulations.
Good. Great.
That's great. And I know that Wakefield is part of the Mystic Valley Initiative, right? So you've worked with some great people. I've worked with a lot of them as well. That's great background. Great.
I feel like we found the perfect person to do the job.
Thanks. I'm really excited to get
No,
started.
this
So,
is great.
so-
I mean, we've wanted this for a long time, and I think everyone, critics have said that we don't have a lot of youth use of tobacco, but obviously the vaping issue is a completely other animal. But I think we never really got a sense of what was being sold illegally against the regulations. So I think it'll be good to get some good data and just get out there. It's great. Good.
So I would ask that the board formally appoint Erin as a special agent of the Board of Health as a tobacco compliance officer, because she will be doing enforcement on your behalf. She is potentially will be sending order letters and writing people fines. We hope it doesn't come to that, but she will have the authority to do that. And in case anyone ever were to legally challenge one of the fines or legally challenge her authority to be doing that on your behalf, I think you should vote to appoint her, and I will also have the town manager appoint her. So if you could take a vote on that, that would be great.
Sure. Do I need a motion, or we just take a vote? Karen?
Be a motion to appoint Erin
Okay.
as a board special
All
agent.
right. Do I have a motion then to appoint Erin Murphy as a special agent to the Board of Health for the purpose of tobacco compliance, inspection, and enforcement? Do I have a motion to?
Yes.
I so move.
And second?
Second?
I so move.
All right. All right, let's vote. I will ask Ray, you vote.
Yes.
Jill?
Yes.
Mark?
I approve.
Alma?
Yes.
And I absolutely approve. So this is great for us. Thank you. The motion has passed.
Thanks so much.
Good, welcome.
Welcome aboard.
Thanks.
Yeah.
Right.
All right. Susan, what's on the horizon with the mosquitoes?
Thankfully, not much.
Good.
Like the last thing we need is a bad triple E season. I think they've had one human case down in Bridgewater, but nothing like last year, thank goodness.
Yeah.
We're getting some West Nile virus positive mosquitoes in sort of the towns around Boston inside 128 that are the more urban towns, but we see that every year. So it's what I would call sort of a normal year.
Okay. All right. Let's hope it stays that way.
Yeah, but DPH reached out to me last week to get the name of our public information officer, Erin Stevens, because DPH has created all kinds of messaging around triple E that they will just send directly to the towns for the towns that need it, which will make things much easier in case we need to get public messaging out.
Okay. Yeah. So instead of you taking the time to draft everything and put it out, they'll have. Okay. It's good.
Yeah, they listened to what we said from last year, so that always nice to know you've been listened to.
So we actually had the spraying, did we?
No, we haven't sprayed. We sprayed last September, but we haven't sprayed this year, and we won't unless things get really bad. But
Okay.
I mean, it's the middle of August. I think if it was going to get bad, we'd know it by now.
Yeah.
That's true.
Well, with all the outdoor dining, let's hope that it stays quiet, because it definitely will help the retailers to not have more than COVID to worry about.
Yeah.
But last year, I recall we were very worried about this fall sports season, so we won't have to worry about that this year.
No.
Well, we may. So true.
A silver lining.
I like that. Glass is half full, Jill, aren't you?
That's right.
Not usually. But
All right. Anything else?
Deb, I forgot, and introducing Erin kind of reminding me of this, that Tobacco-Free Mass policy forums coming up on September 30th, and it's going to focus on the menthol flavored tobacco ban.
Okay.
So I can get information to you, Susan, and perhaps you can share it with members if people want to attend. It's a virtual virtual conference, of course. But it will talk about sort of what's next in tobacco control and also focus on some of the things that worked with the tobacco flavor ban.
Great. Yeah, that would be good. I would like that.
Yeah.
Definitely.
Good.
Yep. I will try to attend.
Yeah, September 30th.
Perfect. Thank you.
I think it's $50 a registration, so it's very affordable.
Okay. Yeah, we should try to get Aaron on that too. So.
Yep.
Good.
Definitely.
A quick question. When we deputized Aaron, it reminded me that we had deputized the police to be enforcers of the mask issue. If there was a need, has anything come up like that, Susan?
I think that they're doing friendly education. You know, there was a lot of, in the beginning, as you remember, there was a lot of sort of negative interactions on the Bruce Freeman Rail Trail and town trails, and the police tried to just get out there and do it in a nice way, remind people that they had to wear masks. And Governor Baker has also, when he did all the big announcements last week, he said state and local police can enforce all the, you know, he reduced the gathering size outdoors from 100 to 50 people and made it apply to private property and then deputized police to enforce it. So I don't think we've had any big gatherings in Concord, but you know, for the towns that are still experiencing outbreaks, I think they're thinking it's related to big gatherings, and it's nice to know the police can enforce on private property.
Yeah, absolutely.
Because it needs to be done in some of the towns, not Concord, I don't think.
Yeah, I haven't heard of any big gatherings here, so.
No.
All right, I don't have anything else. So I will move to adjourn the meeting unless there's any objections. Hearing none. I hope everyone has a pleasant evening, and I will close this meeting of the Board of Health.
You have to do it by roll call.
Everybody.
Oh my goodness. All right.
You have to. It says you have to.
Okay, Mark.
I approve adjourning the meeting.
Jill.
I approve.
Ray.
I approve.
Alma.
I approve also.
Oh my goodness. Thank goodness. All right. I approve.
There you go.
All right. Thank you, everyone.
Thank you.
Good night.
Have a good night.
Have a good
Bye.
vacation,
everybody.
Mark.
Right all. Thank you for
Have
your work.
fun.
Thank you.
Thanks, Jane.
Bye.
Bye.
Bye.